Hi, how's your day been like so far? Welcome back to Health and Medicine. Inflammation happens in everyone, whether you're aware of it or not. Your immune system creates inflammation to protect the body from infection, injury, or disease. There are many things you wouldn't be able to heal from without inflammation. Let's talk about what you need to know about inflammation today. What is inflammation? Inflammation refers to the process of your body's white blood cells and the chemicals they produce to fight against outside invaders, including viruses, bacteria, toxins, and injuries. When your body detects the intruders, it will launch the biological response trying to remove them. Inflammation plays an important role in your body's healing process and is part of your body's defense mechanism. But in some cases, the body can mistakenly recognize your own tissues or cells as harmful, which is when autoimmune diseases happen. Types of inflammation. There are two main inflammation types. Acute inflammation usually happens for a short, while often severe, duration. The symptoms appear quickly and often resolve in a few hours or days, usually equals 2 weeks. The responses include increased blood flow to the inflamed red and release of antibodies and proteins. Acute inflammation can restore your body to its state before illness or injury. Chronic inflammation, it's a slower and usually less severe type of inflammation. Chronic inflammation happens when the inflammation responses linger, leaving the body in a constant alert state. It typically will last longer than 6 weeks. It can also happen when there's no injury, and it doesn't always end, even when the illness already gets healed. Chronic inflammation may leave a negative impact on your organs or tissues over time. Some research showed that it's associated with prolonged stress and autoimmune disorders. Is inflammation painful? Acute inflammation can cause the pain of varying severity and types. Pain can be steady and constant, stabbing, pulsating, and throbbing, or pinching. When the build of inflamed fluid leads to swelling, the swollen tissues will push against the sensitive nerve endings around them. This process contributes to your pain. Other biochemical processes are included too, which affect how your nerves behave and cause pain. What are the symptoms of inflammation? 5 common acute inflammation symptoms include redness, swelling, heat, pain, loss of function. Examples of the loss of function include finding it hard to breathe during bronchitis, having the worst smell when you get a cold, or cannot move the inflamed joint properly. Inflammation does not always come with all 5 symptoms. Some inflammations don't cause any symptoms or happen silently. Which symptoms you get depend on what causes it and where in your body. Common symptoms of chronic inflammation: constant fatigue and insomnia, frequent infections, body pain, gastrointestinal issues like diarrhea, constipation, or acid reflux, weight gain, anxiety, depression, and other mood disorders. What causes inflammation? Many different factors can cause inflammations, such as exposure to foreign materials that the body cannot easily eliminate, external injuries, including scrapes or the damage caused by foreign objects, such as a thorn in the finger, pathogens like viruses, bacteria, or fungi, effects of radiation or chemicals, certain medications. Certain kinds of foods can lead to or worsen inflammation in people with autoimmune disorders: alcohol, trans fats, sugar, processed meats, refined carbohydrates. What happens when you get an inflammation? Many different immune system cells will be involved when inflammation is happening in your body. These cells will release various chemicals or substances, also known as inflammatory mediators, including histamine and bradykinin. They can cause small blood vessels in the tissue to dilate, allowing more blood to reach the inflamed tissue. This is the reason that the inflamed areas are usually red and feel hot. The increased blood flow can let more immune cells be brought to the inflamed tissue, helping with the healing. The inflammatory mediators they release can irritate your nerves, which causes pain signals to be sent to your brain. The immune cells also bring more fluid to enter the tissue, making it swell up. But the swelling will go down after the fluid is transported out of the inflamed area. At the same time, the mucous membranes can release more fluid. For example, when your nose membranes get inflamed, you will have a stuffy nose. This extra fluid can help you flush the viruses out quickly. What you can do to reduce the risk of chronic inflammation. Follow these 6 tips for reducing inflammation in your body. 1. Load up on anti-inflammatory foods. Your food choices are just as important as the medications and supplements you may be taking for overall health, since they can protect against inflammation. Making good choices in our diet to include fresh vegetables and fruits as well as reducing refined sugar intake can make a big difference, Dr. Pitta says. Eat more fruits and vegetables and foods containing omega-3 fatty acids. Some of the best sources of omega-3s are cold water fish, such as salmon and tuna, and tofu, walnuts, flax seeds and soybeans. Other anti-inflammatory foods include grapes, celery, blueberries, garlic, olive oil, tea and some spices, ginger, rosemary and turmeric. 2. Cut back or eliminate inflammatory foods. An anti-inflammatory diet also limits foods that promote inflammation, Dr. Gray adds. Inflammatory foods include red meat and anything with trans fats, such as margarine, corn oil, deep-fried foods and most processed foods. 3. Control blood sugar. Limit or avoid simple carbohydrates, such as white flour, white rice, refined sugar and anything with high fructose corn syrup. One easy rule to follow is to avoid white foods, such as white bread, rice and pasta, as well as foods made with white sugar and flour. Build meals around lean proteins and whole foods high in fiber, such as vegetables, fruits and whole grains, such as brown rice and whole wheat bread. Check the labels and make sure that whole wheat or another whole grain is the first ingredient. 4. Make time to exercise. Regular exercise is an excellent way to prevent inflammation, Dr. Gray says. Make time for 30 to 45 minutes of aerobic exercise and 10 to 25 minutes of weight or resistance training at least 4 to 5 times per week. 5. Lose weight. People who are overweight have more inflammation. Losing weight may decrease inflammation. 6. Manage stress. Chronic stress contributes to inflammation. Use meditation, yoga, biofeedback, guided imagery or some other method to manage stress throughout the day. We may not be able to change many of the stressful situations we encounter in life, but we can change our response and perception by learning to manage stress better, Dr. Gray says. It's important to remember also that measures to reduce inflammation pay off over time with improved health and reduced risk of chronic disease. Whether you're aiming to prevent cancer, heart disease, diabetes, dementia, or other conditions connected to chronic inflammation, the sooner you incorporate these 6 steps into your life, the better. If you want to know more, follow us on Instagram, Health Medicine MDMPH. We're providing daily health hacks and updates to help you to live a healthier and happier life every day. Let's make small but daily progress, which will make a big difference in the near future. You can also find our Instagram link in the description box below. If you found this video helpful, please like and share it with others who may find it helpful too. Your ongoing support has helped us make health and medicine more accessible to everyone. Thank you for watching, and we'll see you in our next video.